Our guest tonight, friend of the show, friend of mine, friend of my family's, and I think someone who we all became very familiar with and looked to during COVID for that calming voice of expertise at a time where so many of us didn't know what the hell was going on and who we could turn to. Dr. Vin Gupta, NBC medical analyst, Princeton, Cambridge, Harvard educated, and a super nice guy. Welcome to the stakes.
Thanks. Thank you both for having me back. I just couldn't be more urgent times, but you have an amazing platform, so thank you.
Oh, no, the pleasure is ours. And it really is a privilege to have access to someone like you because not everybody does. And so we're blessed to be able to bring you to our audience. I think I should start off with the question that probably everyone wants to know. What is keeping you up at night?
Yeah. Oh gosh. I'm gonna try. I'm gonna try to frame this without sounding alarmist, but I would also say that since we're not getting really any press briefings, we're not getting the usual outputs that we would expect from health leaders within our government. I'm just going to tell it like it is. I think what really worried me, Michelle and Tara, was when I found out. You may have seen this news cycle a few weeks ago. There's a big cat reservoir. Lions. I even think tigers here, just south of Seattle. It was about 2 or 3 weeks ago when there was word that bird flu had spread from bird farms to cattle farms to then ultimately this big cat reserve south of Seattle, and that 20 big cats had died from bird flu.
No.
And it was sort of like you catch your breath moment where up until 12 months ago, bird flu was not detected in cattle. That was a seminal moment. And I think now we've just gotten so used to talking about bird flu in our dairy supply, hence all the risks on drinking raw milk and between that and RFK. But then when it got to the fact that big cats were dying of this after we already had now cattle, we've had to do all sorts of things when it comes to culling cattle. Hundreds of millions of birds across the world have been culled. I mean, this is a massacre when you really think about mammalian species. And now just out of the blue, 20 big cats have died. It feels apocalyptic in the worst way, in the sense that from a I think about this all the time, but what are the respiratory viruses that change almost instantaneously? There's two of them. There's two families of them. One is coronaviruses. We've had a lot of experiences with that now with COVID. The other, unfortunately, is flu. And I would argue that flu is an equal opportunity danger to public health across the world, in the sense that a bad flu strain can impact a teenager, it can impact a young person, and can impact somebody with pre-existing conditions. And to give you a sense, in my ICU, I've been on service in and out over the last several weeks, and I have two women in their fifth decade of life. They're both they were not protected against flu, unfortunately, and they came down with a severe illness of flu A. They had secondary infection with MRSA, and they are not just on a ventilator and on dialysis. They're on extra. They're actually where we use a machine to take the blood out of their body, oxygenate it, and then deliver it back to a big IV.
Oh my God! I thought that was only for Keith Richards.
No, and no, it was. It's called ECMO, extracorporeal membrane oxygenation.
I remember hearing that. Yeah.
Yeah, exactly. This is something that sort of became norm throughout the pandemic. But it's to say that what worries me is flu. Flu really worries me in the sense that it changes quickly. It can be incredibly dangerous to humans. And the fact that bird flu is changing this quickly, this fast, and it's impacting basically every other mammal aside from humans should worry us all.
Can you explain exactly what bird flu is? I mean, I know it's a colloquial term, but what exactly is it?
Yeah, and so basically there are, on the surface of a flu virus, there's two proteins. And one of them is affectionately called, the short term is H, and it stands for hemagglutinin. And then there is another protein, neuraminidase. Again, and this is getting probably too technical, but it's to say that there's an H protein and an N protein on the surface of any flu virus. We typically deal with, say, H1N1. That's just how we label human flu. In this case, H5N1 is something that we haven't seen a lot in humans. We've seen about 70 cases, but it is quote unquote bird flu because it's devastating bird populations across the world. So it's just it's a different type of flu virus because the proteins in the H family and the N family look a little different, hence the different nomenclature, H5N1. The reason why that matters is right now it's a lot harder, Tara, for that version of the flu virus to impact human cells in our lungs, for example, and then for us, if we're infected, to then go and infect somebody when we say sneeze or cough. H1N1, very easy to do that, which is why this is a pretty bad flu season. The worry here is that if H5N1 in the human body, and we've seen some sporadic cases of this cause severe illness, if that changes, and again, it doesn't take much for it to change, suddenly you have a virus that might be like H4.5, N1.5. I'm making that up, but the idea here is that just minor changes can make a virus become non-transmissible to very, very transmissible, very contagious. It doesn't take a lot.
And that's what happened with COVID, right? With the different versions of COVID, the protein makeup or whatever changed, and then it got even, like the last Omicron or whatever was like super contagious, but not as severe.
I lost count.
Right? So similar.
That's right. That's the exact same principle. You completely nailed it, which is the surface of these viruses changes, and as it changes, it becomes more or less able to enter our bodies, say the cells lining our lungs, causing pneumonia, causing serious infection. With Omicron, it was able to do that much more easily than, say, the original version of COVID. The fear here is that something is changing in nature. And, it's like the Jurassic Park line, nature finds a way.
No.
I don't like that.
No.
Yeah, exactly. That's where we're throwing the line between information and alarmism. But it is to say, but in all seriousness, flu changes rapidly. Something is happening across mammalian species, not human, that should worry us all, because it doesn't take a lot for there to be a jump.
Michelle?
Yeah, well, I'll tell you the thing that freaks me out, because we were very lucky with COVID that we had, what was it, a year or so before we started getting the vaccine. And, we have a flu vaccine, and I am curious how easily it would be to make a vaccine for something like this under the current circumstances with this administration and Robert F. Kennedy Jr. in charge of Health and Human Services, because that is terrifying to me.
And the U.S. out of WHO.
Well, that too. Jesus.
No. It's the right question, and it's such an important question, especially given what happened yesterday, where they canceled the Vaccine Advisory Committee, determining what is our flu vaccine going to look like in September of 2025. Turns out there's a 6 month. So Michelle, to answer your question, it requires about a 6-month manufacturing cycle to produce flu vaccines smartly. If we're going to have smart strain, if we're going to thoughtfully say, hey, this is what we're seeing in Australia and the UK, here's what our WHO friends are telling us is happening across the world, so we can be smarter in the design of our flu vaccines. That information is great, but then we input it, and then it takes 6 months to manufacture smart vaccines, or as smart as we can get them. It's not always perfect. That doesn't appear to be happening. And so, the administration can play coy and say, well, they're just, pausing it. But if they pause it for any more than, say, a week or two, suddenly now we're completely off kilter when it comes to a vaccine schedule that we rely upon. So this is serious. To your point, we're going to be relying on on pharmaceutical companies that are not based in the United States. We're going to be flying blind. We're not going to be participating in the WHO, which is not going to be, the WHO relies on hundreds of millions of dollars of our budget to be functional. And yes, they have problems. I don't think anybody is denying that they have problems.
Sure.
But the response shouldn't be, let's just let it go and burn. It should be, let's make it better. Without that, the WHO's processes are not going to be as strong without our participation. But then also, we're going to be in the back of the line, probably overpaying for vaccine supply, number one. Number two, those vaccines are probably going to be much worse at protecting against bird flu without necessary cooperation and collaboration. So really, this is performative politics. Oh, we're pausing the vaccine committee meetings. Oh, we're pulling out of WHO. This is the last thing from an America First perspective that's actually good for people and going to help people succeed and stay healthy, have a durable income. This is the last this is America last in many ways from a health perspective.
It boggles the mind that someone, to your point about the America First thing, that Republican senators whose fault this is, okay, we're going to not go on about why people were, putting their heads up their asses and voted for Trump again, not believing what he was saying he was going to do. Cast that aside. Now he's here, and we have Republican senators who are supposed to be there as a stopgap to any kind of insanity coming out of a president and putting up unqualified people. Robert F. Kennedy Jr. was probably the worst possible person on the planet you could have put in that job, given all of the threats we face and what we came out of. And yet, none of them had enough sense, including the doctors who are senators like Cassidy and others.
I couldn't believe that.
Knowing they know what you know. And for them to put our country, the average American, because guess who it's going to kill off first? The poor Trump supporters who live in their red states who can't afford to get the vaccines or pay more money from the pharmaceutical companies, or, they're going to cut Medicaid too now. So I don't know how they're going to get anything. I just don't understand it.
It's really interesting. There's something happens, I think. And he was he's a gastroenterologist in Louisiana. He did amazing things on Hep B vaccinations in Louisiana. But something must happen either way, because I've been thinking a lot about this. Why does power distort, or what is distorting the MDs that are proximal to this administration? So I think of Senator Cassidy. He is afraid to lose his seat. He's running for re-election. Power is distorting what should be his ultimate commitment, which is the oath to the profession of medicine. Right. That should be number one. Everything else secondary. That's obviously not the case. Marty Makary at the FDA. This was once a respected surgeon at Johns Hopkins. Have a ton of respect for his clinical acumen. He's going to be the FDA chief. And by the way, he's replacing a lion in Rob Califf, who did all the right things, but obviously we live in strange times. Marty Makary is now somebody that most everyone I know in clinical medicine looks at him and shakes their head and says, what happened to the guy? He went on Fox News, and I think he saw maybe a path to notoriety. I don't know, but basically made all of our lives much harder, Michelle and Tara, throughout the peak of the pandemic. He was one of the very prominent voices saying, hey, the COVID vaccine causes myocarditis more than the virus itself.
Oh my gosh, I remember that.
And that's the guy. That by the way, that guy is going to be working with RFK Jr. to disprove or approve vaccines. That's what we're faced up against. And so, yes, it's a broader thing too. My wife's a pediatrician. We were talking about this with her pediatric colleagues. It is very close to the AAP, American Academy of Pediatrics, and their president, Dr. Hoffman. And we're all saying the same things behind the scenes. I'm going to say this to you publicly. There is no physician I know, and multiple degrees of separation. I feel like I can speak for my profession and the 99% of them that are credible, sane, a healthy majority that you'd want caring for your loved ones or for you if you, God forbid, were in the hospital. Not one that's credible, that actually practices, that has great credentials, likes any of this. Is it on board with any of this? They have alienated large societies. They have alienated the credible and credentialed amongst us. And you know who they have around them? Guys like Makary. They have people like Cassidy, who don't have a spine. They also have people like around Kennedy, like Dr. Means, that apparently went to medical school but never practiced. And so there's something humbling about the idea of, hey, you have to feel these consequences at the bedside.
Right.
To be humble about how you speak about things and what you do and do not say. And because they don't have that humility, because they don't have that experience, they're off saying anything. They don't deal with the direct consequences the way we do.
Wow.
Well, and on that note, I would love to switch gears a little bit and talk about measles. What's going on with measles? I'll play a clip here of the cabinet meeting yesterday with Donald Trump and Elon Musk and RFK Jr. and what he had to say about measles outbreaks.
Bobby, do you want to speak on that?
We are following the measles epidemic every day. I think there's 124 people who have contracted measles at this point in Gaines County, Texas. Mainly, we're told in the Mennonite community, There are 2 people who have died, but we're watching it, and there are about 20 people hospitalized, mainly for quarantine. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it. Incidentally, there have been 4 measles outbreaks this year in this country. Last year, there were 16. So it's not unusual. We have measles outbreaks every year.
You sound a little under the weather yourself right now.
I have a permanently bad throat.
I can't.
I can't with these people. They, it's just like what they joked the other day about Canada being the 51st state, and everybody chuckled, and I just couldn't.
Right. I mean, so I hear him say that about, oh, well, there were 16 last year. There's been 4. Well, yeah, it's February 27th. There's already been 4. First of all, there should be 0 because this is entirely preventable. So my first question is, and I talked to a lot of my friends about this because do we need measles boosters? And I've heard conflicting answers about this because, I was born in the early 80s and I was told by my GP, your titers might have fallen below the threshold because people within a certain age range may have only received 1 dose in their MMR series. I had my titers tested and I had fallen below the threshold. So a few years ago, I went and got a measles booster. Very easy to do, painless, quite frankly. So I would love to know what you think about that. And should people just go ahead and do it? Should they check? How dire is that?
My general advice, to keep it as simple as possible, I would say if you're born before 1957, the belief is that you likely were exposed and have some degree of natural immunity, so you don't need any form of a booster. So if you were born before 1957, you should be good. If you're born between 57 and 89, so I'm in also that group, I would say that don't bother with the titer and just get it. I also got a booster shot, and also because I have young ones at home and all the things, and and my wife's a pediatrician. You just don't know, and I think all of us have different risks of exposure. But I live in a state in Washington State where actually exemption rates for the measles vaccines are higher than you would think. It's not as high as Texas.
I'm not surprised. That's those tech people out there that that have money and they think that they can just eat granola bars and like drink filter, some kind of artesian water, and they'll be all right.
Exactly. And so it's but there is that sense that a booster, to be as clear as possible, if you have questions, by all means, the incremental approach is you can get a titer, and if the titers are low, get the booster shot. Or you can just make it simple and say you would prefer to get the booster shot. And in most cases, insurance should cover the booster shot at this point for that group born between 57 and 89. If you're past 89, you are good, and you should, presuming that you were vaccinated, and hopefully parents for their kids that were born after 89, or if you're an adult at this point, you have some version of a record. What I would say is if you're medically higher risk and you were born before 1957, that's a group where I would say if you're on an immunocompromising medication, if you're on dialysis, medically higher risk, you probably should get titers to confirm you are good, because that's a case where if you're medically higher risk because of age and an underlying condition, the pre-1957 thing, I don't buy for that specific group, and I'd say go ahead and get a titer.
That was going to be my follow-up question, because as you know, my mom is immunocompromised, and she's a severe asthmatic and is oftentimes on heavy doses of steroids to manage her asthma, unfortunately. And we tried, very hard to not do that for all the reasons. But she was born in 1954. And so, we were just having this conversation, and I was like, well, I will ask Dr. Gupta, for people like her, is it worth getting I think what you're saying is getting the test first just to double check, or should she just go to the doctor and be like, okay, give me the shot?
This is where I would say, if it were me, I would say just get the shot. Sometimes what ends up happening, and this is, a whole other can of worms here, is will your insurance pay for it, or are you going to have to pay it out of pocket? Because they're going to say, well, you're before 1957. Why are you doing this? You're going to have to pay for this out of, complete cash. And that's when, you're medically high risk because you have severe asthma, plus your titers are low. Therefore, this sort of prior authorization hell that we put doctors and patients through. Okay, now we'll give it to you. So my general advice would be, if you're open to it and you're basically before 1989, just go and get the booster.
Just go and get
it. And if you're if 57 to 89, just get the booster. If you want, if you're getting insurance hassles, get your titers checked.
Right.
Pre-57, if you're get I would say, especially medically high risk, by definition, you're already older.
Right.
And just, if they don't force you get the titers and you can just get the booster, it's probably the vaccine itself is completely safe. It might cause a mild self-limited rash, maybe a low-grade temp. There's no safety issues, which, by the way, is becoming, that's a whole other can of worms with RFK and his prior organization, what they're doing. But just get the booster if it's easiest to do it from a financial standpoint.
I see a couple people in the comments have asked a few questions, and one of them was, can you explain again why pre-1957 folks are okay? Because I heard it when you said it, and I said, oh, because I wondered that, because I've heard other doctors say it, because that doesn't make sense. I'm like, wait a minute, if it's before 57, you're older, they didn't have the vaccines the same, why are they okay? But I heard you explain what you could just repeat why pre-1957. And then also for people, there's a few people here that are like, I'm not getting any more shots. I'm not getting any more vaccines. Damn that. I think that's stupid, but I think that you can explain it in a much nicer way, more diplomatic than I can, about why they should get those vaccines. So questions 1 and 2.
So it's question 1. The idea here is that before 1957, if you're born sort of 56 and before that, the idea here is that measles was endemic and everybody was exposed, and therefore there is a belief that you already have exposure and protection through natural immunity. Unfortunately, that we know, especially with COVID, since we talk so much about natural immunity, it can wear off. Exactly. And so my advice would be, people pre-1957 are already getting a bit older, and get your titers checked if you don't want to answer question 2. If you don't want to get another vaccine, or if you don't feel like you need to, get your titers checked. And you can add it on as a blood collect when you get your next lipid panel, or when you get your A1C checked. I'm not saying go get a special test. Do it as part of your primary care screening process. Most primary care doctors are tracking what's happening across the country and are proactively already doing some of these things. Just ask for a titer to be added on to your next blood test for, screening purposes for, say, something else. It shouldn't add any additional friction to you. Your insurance should cover it. So there should be really no issues to do the titer check. If it's easier to do it, my recommendation would be just be safe, especially since there's so much unpredictability, and get the booster.
Someone asked if they have heart disease and diabetes, is that considered high risk? I would say yes, but you're the doctor.
Yes, you're 100% correct, Tara. That is, I think we can hem and haw on, well, are you well-controlled diabetic? What's the degree of your heart failure or heart disease? But usually I would say those two things make you more vulnerable to infection in the first place, regardless if they're well-controlled or not. If they're poorly controlled, whole different level of risk strata, but you're a higher risk just by having those conditions.
What about folks going to other countries, like going to Canada or to Mexico, in case they can't access the vaccines that we would normally have here? Are you comfortable with Americans who have the ability, like folks who live near the borders, to just hop on over? I mean, they've done it for other things like dental care and stuff, because it's cheaper there. But are we really looking at a situation here where we may have to go to our neighbors to the north and south?
I hope not. And I do hope they come to their senses immediately and reschedule the vaccine advisory committee. I hope so. That said, pharmaceutical companies ultimately will have some say, as other countries will, on what happens with our flu vaccines. And so this thoughtful preparedness is happening in other parts of the world still, thankfully. And yes, I have no concerns from a quality perspective on vaccines that are accessible north of our border or south of our border, because frankly, we know that the vaccine supply there is incredibly safe, and the same guardrails and protocols are used to design vaccines going to Mexico and Canada as they are here in the United States. So no problems.
That's good. Michelle, do you have another question? I have a couple more.
Well, yeah, we're fighting disinformation on like several fronts, just about I mean, I feel like I'm fighting with people about, is the sky blue at this point?
Yeah. Or what do I always say, Michelle? Arguing with people that the sun rises in the west and sets in the east now. And we're the
correct.
assholes because we tell them they're wrong.
Yeah, like how dare I, you elitist and your books and
Right.
your knowledge. I looked this number up today, and thinking about RFK Jr. and how he appeals to the wellness community, which is just, I mean, I can't. And the big pharma and how, all these doctors and all these people, scientists are making all this money. The pharmaceutical industry accounts for about $1.6 trillion, but the wellness industry accounts for about $6.3 trillion.
Yep.
What a racket.
Which is a racket.
And
there's some people that I guess, you're just not going to change their mind. My sister is an anti-vaxxer. I don't forget, I can't. But how do you talk to someone who may be vaccine skeptical because, I'm going to get the flu vaccine, but I hear you get the flu. Like, how do you talk to people in a way that will make them understand that how important it is, not just for them, but the people around them?
What I'm hoping to do, I think we made a big mistake in the early part of the pandemic, and we're ruining it, which is our leading health officials at the time. Not gonna, I won't point fingers, and I always try to stay clear of doing this, not trying to say that I somehow knew something they didn't know, but there was I don't think ever, Michelle, to answer your question sort of in a roundabout way, has there ever been a vaccine for a respiratory virus that has prevented infection? It's never happened before. And so I remember when I was talking about it early days, we would show a picture of lungs with and without COVID, and really to try to convey to somebody, this is why you get the vaccine. Because most people have ever seen the inside of a hospital. They don't know what an ICU bed looks like. They don't know what lungs ravaged with COVID look like, or in this case, say flu, or by the way, I mean, this is a quick tangent. RFK said they admitted 20 kids for quarantining. That's not true. That's false. The spokesperson for the Children's Hospital in Lubbock said that 18 kids were admitted for oxygen needs, i.e., in other words, they have pneumonia. You don't admit people to a hospital for quarantine. That just never happens. So I call into question his team and how he's getting briefed, and frankly, his understanding and competence on basic clinical sort of knowledge, because that was a weird slip. But to answer your question, Michelle, I think fear is motivating. I hate to say it. And a healthy amount of learning about what measles is doing right now to kids in Lubbock, Texas, in that children's hospital, and telling those stories helps crystallize why we do what we do. And it also defangs a guy like RFK that's always a what about guy. Oh, well, what about this? What about that?
Yeah.
We could do that all day long.
Right.
Medicine's imperfect. There's so much we don't know. Of course, we're using our best judgment, but he uses it and he weaponizes a data uncertainty to say that we're hiding something. And that's why he's alienated any credible healthcare provider, because of course there's a lot of uncertainty, but there's no uncertainty as to why you get the measles shot. There's no uncertainty as to why you get the COVID and flu shots. We know why you do that. We also know what we don't know, which is, of course, it doesn't prevent infection completely. We know that immunity against that specific type of protection wanes pretty quickly.
Yeah.
But those are known unknowns. But he weaponizes the unknowns to say that somehow we're committing a crime, or that we're intentionally covering people's eyes or deceiving them. And that's what's wrong.
There are, my own family member, my aunt, refuses to get a vaccine. And I think she got COVID 3 times, and I don't know how she survived it. She was really, really sick a couple of the times, and it scared her. And even then, she was still, she's giving it to Jesus. And we're like, oh my God. I'm like, Jesus also gave doctors knowledge and science. And why can't it be that Jesus actually helped them develop a vaccine so you can have your own free will to take it?
That's right.
It's really frustrating. I know, Michelle, family members too, like all of us, we've had to deal with folks like this. But I think at some point, people don't change until they pay enough of a price. And for some people, that may ultimately be the price may be their lives or the lives of their loved ones. And there's nothing we can do to prevent that if they don't want to face the facts here. And, looking at, I think, children starting to die from measles
will
may
be
wake some
motivating.
people up. I would hope so. That would wake some folks up.
I hope so.
I know. Please give us some good news.
Oh gosh. Well, it's February 27th, and I see the sun set here in Seattle. That's good news,
In the
news for us.
West.
We don't actually see
the
sun,
West.
until June here in Seattle. So that's good news. But listen, there isn't a lot of good news right now. I'm sorry to say that. Medicaid's on the chopping block. I'm worried about bird flu. We're worried about I think things are going to get worse in Texas before they get better. And so I guess what I would say is we're in the thick of it, and things can only get better from here, I hope, at least with the infectious disease piece. So we have about 2 to 4 weeks to get through, team, before hopefully things start to get better. So the good news here is that hopefully relief is on the horizon.
Top 3 things you want to leave people with that are still asking questions like, should we go and get all the vaccines now? I know a lot of folks are wondering about that. If they get the shingles vaccine and the measles vaccine and the COVID vaccine, like, do you have to space them out? Can you take all of them? What do you say to people about that? Top 3 things that folks should walk away from as they're trying to prepare and be smart about stuff as we're facing this perilous time.
Absolutely. So when it comes to, one, it's not too late to get the measles vaccine if you live in Lubbock or nearby. 1 dose gets you 93% protection after about 2 weeks. 2 doses, 97%. So it's not too late. Please still do it. I would space out, say, things like measles and shingles by 2 weeks. Combining those two, I don't think there's a lot of data on in terms of how it may impact protection ultimately. And so don't combine those two at the same visit. Try to space them out. COVID and flu vaccines, it's again not too late to get them. I think we're going to be in flu until probably late March, early April. So hence relief on the horizon, but also space them out into different arms. I think the data was not totally clear on whether you can do it same arm or different arm, but it looks like different arms, same time is better than same time, same arm. So something to keep in mind. And then what I lastly say here is really critical that if you have flu-like symptoms at this point and you're medically higher risk, so if you have a baby or a toddler that you don't know their vaccine status or they didn't get vaccinated for any of these conditions, flu, COVID, or measles, if you're somebody that's medically higher risk, critical to make sure that you go and present to a medical provider and get tested, because early testing, early treatment keeps you out of the hospital. And I think enough people don't have primary care access, or they are underinsured, or they just don't know the importance of getting tested because there's good treatments here, especially in the case of COVID and flu, that early testing can really keep you out of the hospital.
Well,
yeah,
thank you.
Yeah, thank you. And there's just one thing I wanted to say before we wrap up, is that, I was in a theater, I think 1.5 years ago, and I saw Dr. Anthony Fauci in my row all the way down, and I regret not chasing him out at the theater to thank him. I also didn't want to scare him because I know he's been through a lot, but we don't get these opportunities very often to thank the people who really made a difference. And like I said, I live in New York City. We were the epicenter. We were the first. We got hit the hardest, and we were really just left in the dark. And so, Dr. Gupta, thank you so much for being one of the voices where when we turned our TVs on, we heard from you. And I can't tell you how much that meant to so many of us. So thank you.
Amen and amen to that. And we are so grateful, like I said, to have access to you. And we had talked about making this a regular thing as we're going through all of this, because it's important to have trusted voices that we know will give us the facts and to educate people, because we want to help save lives. So this will not be the last time, people who are watching now, that you see Dr. Gupta with us. We are going to have him on a regular basis to answer your questions and keep us all sane while we suffer through this nightmare together. So Dr. Gupta, yes, go ahead.
No, that'll be my pleasure. And I'm actually going to show this. Just in closing, Tara, you and your family sent this to me. I keep this in my home office, my work office. I move this around. It's very touching, but it reminds me of why I'm in this profession in the first place, number one. But then number two, the importance of why I do what I do. I tell people often, there's a lot of people that are training in medical school that say, how do we get involved in health policy or health communications? And I say, maybe you probably shouldn't move to Seattle, Washington from New York City, because I say that because I didn't ask, I didn't expect for this role. I didn't, I wasn't seeking it out at the time, but now I recognize the vital importance of effective health communication, and I try to do it for the right reasons. But you remind me of that every day when I have this prominently positioned, so I can see it. So thank you again for the trust.
My pleasure. My pleasure. You're gonna make me tear up, Vin. You're the best. You're the best. God bless you. The best to your family, and we will see you soon.
Appreciate you guys.
Thank you.
Have a great night.
Oh my God.
What a mensch.
He's the best. He's the best. What
a mensch.
It's such a privilege to have access to folks like him, and he's just so humble and gracious. He is, like I said, Princeton, Cambridge, Harvard. Okay, he is like the top of his profession.
When I read his resume and then I realized how old he was or how young he was, I was like, how does anyone get all of that done in that little of time?
Yes.
I mean, I was like blown away.
In the Air Force.
Right.
He's